So just checking you're all still awake. We're all still awake? Because I know it gets towards the end of the day and you've had death by PowerPoint and you're all flagging a bit. So hopefully I can give you just a few takeaways today. So this is me. I'm Head of Staff Experience and Wellbeing at an acute trust over in Norfolk. And yes, I did need my passport to get here today. So we are a small district general hospital in West Norfolk. And Liz, wherever you are, I noticed we're not a dot on your map, so please do link in with me afterwards. We have 4,000 staff, 439 beds, 18 wards, and we service a population of 331,000 covering Norfolk, Cambridgeshire and Lincolnshire. And we also have over 300 active volunteers. Now the bad news. In 2015, we entered into special measures. Now I'm going to be really careful here because in the NHS we use a lot of jargon. So I was going to say, if you hear me saying it today, throw something at me, but you're all a bunch of really engaged people, so I'm not going to say that because you possibly will. But special measures means that there are serious concerns about the standard of care we was given to our patients. So, in 2018, we finally got out of special measures. But we returned to quality special measures back in 2019. Talk about not learning for the first time, eh? And we was rated as inadequate. We had a workforce that felt bruised and broken. So what did we do? The only way is up, surely. So we asked key stakeholders what they wanted and indeed needed. We made sure our mission and our values represented that and the standards that we wanted to reach. We set strategies and our KPIs to measure our success, and that is a key factor. And we implemented a health and wellbeing programme to take care of our staff, those staff that were left feeling bruised and broken, the same staff that we wanted to work incredibly hard to get us back to the top. We set up a staff ideas scheme. We empowered staff to make quick changes to help us along the way. So, what was the approach to delivering these improvements? We had the right people in the jobs to drive the change. Fundamental was ensuring that each of our staff members, which included our volunteers, had a voice, and that we was actively listening, not just waiting for our turn to respond. And we secured the funding to support it. So we can have all these big plans, but if there's not the money there and the finances to back it, it's pointless. And we had a governance structure put in place that held us all accountable for what to say. You really doing this? Provide us with the evidence. So we put in a real robust governance structure to support that. So how did it go? Well, as you can see, we're looking really smug at the bottom there, so we must have done things well. So we designed a staff engagement programme that factored on the financial, emotional and physical health of our staff, because they were the people that was going to rise us from the ashes. So we won quite a lot of awards last year. The Chartered Institute of Public Relations, CIPR Awards, an Excellence Award, and anybody that is in the game knows that's quite a high award, quite a high accolade. We won the NHS Communicate Award, and we was used as a case study for NHS employers for improving staff experience. And I was a speaker at the Menopause in the Workplace Conference in 2022 and NHS Comfort in 2022. Our learnings. So the key to our success: a clear programme of work and a real relentless focus on priorities. Resource and investment. Don't forget your charities. Most of ours over 2 years was funded by our charitable funds. We had clear links to corporate strategy. And everything that we did and everything that was asked, we said, where does this triangulate back to the strategy? KPIs, inputs and outputs. You need to measure your success. If it's working, brilliant. If it's not, go back. Find a different way. Ensure your programme keeps the pace with the progress of your organisation. Think in 6 months chapters at a time. And know who the change agents are in your organisation and use them. So effective leadership is just a key element in the success of a group. And although people are not born leaders, the majority of people can learn to be effective leaders. So, my advice for building a strong culture and a high-performing team. So, I would like you to stand up if you're a leader, please. Excellent, thank you. Now I'd like you to stand up if you interact with people on a daily basis of all walks of life. You are all leaders. You may now sit down. I knew I'd get a standing ovation while I was here, so thank you all very much for that. So, leaders who focus on well-being tend to have a better relationship with their teams. It improves productivity, job satisfaction, helps with reduction of absence, and also turnover. So the Workforce Institute conducted a study over 10 countries. 80% of employees that were surveyed would rather have good mental health than a high-paid job. 60% said their job was the biggest factor that influenced their mental health. 1 out of every 3 employees said their manager fails to recognise the impact that they have on them and their teams. They also looked at the impact on the mental health of employees through the following groups: spouse, partner, doctor, therapist, and manager. Who do you think came out top at a staggering 69%? Correct. It actually ties with the spouse and partner. So for those of you that manage leaders and volunteers, you have the same effect on the mental health of those individuals that you lead as their partners or their spouses or their family at home. So it's really important that as leaders, we develop a good environment by changing the workplace practices that affect well-being, rather than focusing on putting measures in place to tackle the negative effects. So, how do we lead for well-being and help create a positive culture of well-being? 1, self-awareness. 2, use of good leadership behaviours that build a culture of well-being. And recognising unproductive characteristics and behaviours that we have that might be having a negative effect on those we come into contact with. As a leader, you need to know yourself honestly. You need to hold the mirror up and say, what is it like to be on the receiving end of me. The standards you walk by are the standards that you accept. You need to be able to manage relationships with confidence and empathy, and not sympathy. Sympathy is being sorry, but also glad it's not you. Empathy is truly understanding and meeting that person in the place that they are at. It starts with you knowing what's good for your own well-being and what builds your well-being, and also what takes away and depletes from your well-being. It's all in one moment's choice. The event and your reaction and response equals the experience. So one of the most vital contributions we can help to build a culture for a high-performing team is to create a dynamic culture that promotes well-being, autonomy, belonging, and contribution. So I don't know whether any of you are familiar with Patrick Lencioni model, 5 Dysfunction of a Team. If you haven't read the book, please buy it. It's a very good book, and it's written in story form, so it's really engaging. So 5 characteristics of a high-performing team are a shared vision, defined roles, a clear and respectful communication, trust and integrity. Trust needs to be at the heart of everything, and continuous learning. So I'd like to end today with a quote from Henry Ford. Coming together is a beginning. Keeping together is progress. Working together is a success. Happy to take any questions.
Thank you, AJ. That's great. So, a couple of questions. I think we've got time for 2. So, in terms of well-being, so Pip asks, what kind of well-being initiatives have you brought in that have been the most effective for your staff?
Good question, Pip. So the first and foremost thing that we brought in was a dedicated clinical psychology team that focused purely on our staff. We have a full-time clinical psychologist, part-time counsellor, part-time CBT therapist, and 20 mental health first aiders working across the organisation. Coupled with that, 65% of our workforce are female. So we really focused hard on the menopause. We have our own staff menopause clinic and menopause champions working across the organisation. We was the first employer to put into our job description that we are a menopause-friendly employer. And that has been the single biggest thing that has helped our staff.
Brilliant, thank you. So we have one more question here from Christy. You mentioned about supporting staff with their financial well-being. Can you give some examples of this?
Yes. So we used the government website Money Helper. We are not experts in that field. So we provide education for our staff around the use of their finance. We have an external company come in once a fortnight for staff to have a drop-in session. It's from the Money Advice Hub, and they help with debt advice, help staff members complete forms, apply for loans, etc. We also have a crisis loan that staff can access. We have a paid-for subscription for the next 5 years to the Edith Cavell Trust that staff, nurses and healthcare assistants can access, again, for financial health and support. And we also brought in an application called WageStream that allows our staff to access their money, or a percentage of their money as it's earned. So that stops staff from going into their overdraft towards the end of the month, because you'll be surprised about how many staff were calling in sick towards the end of the month if they couldn't afford to get a tyre on their car or fuel to come to work. This has really alleviated some of the financial stress for our staff.
Fantastic. And one final question, this one's from me, AJ. So you mentioned the Staff Ideas Forum. I'm really curious, could you expand on how that works? And also, how do you take these ideas, but obviously you can't implement them all without people feeling disenchanted by the whole process?
Okay, so any of you here, and I think that Alex was one gentleman that works within the NHS knows, to get things moving in the NHS, which is the largest complex adaptive system in the whole of the world, things take time. And business cases, papers, goes to this committee, goes to that committee. And they're saying, actually, I want £2,000 to get some dementia clocks. I want to put a mural on that wall so that when patients come in, they've got something bright and cheery to look at. Normally, that was like, go to the manager. Well, actually, we're probably going to have to do a business case for this. People start to think, what's the point? We're not going to get the money. Their ideas start to dry up. So we put something in place which was called Room for Improvement. It has a short form. Staff complete it, put their idea, and I think they can now bid up to £5,000 at a time, attach a quote for what they want. It goes to a panel of just 2 people. They get an answer within 24 hours, and so it really cuts down the process. So basically going from 6 months to 2 days, it really empowers staff to really harness, bring that inspiration, and they're getting quick results.
That's fantastic. And actually, if we could, just one final one, because I think this one's a great one, actually. I think a lot of people will probably be wondering the same question. So, thank you, Gabriella. Without resources to invest, what is the one change you would make to improve staff well-being?
Good question. The answer's quite simple. Better leadership. Educate your leaders to lead for well-being. Have those corridor conversations. They're so powerful. Educate your managers and leaders for those well-being conversations that they need to be having on a daily basis. Put measures in place to support your staff. Walk the walk, don't just talk the talk. If we build better leaders that actually care for their staff, that role model, that allow themselves to be vulnerable, and you give permission to say when they are struggling and that it's okay, well-being will look after itself.
That's great. And actually on that one just bit of feedback from me as well, is that we've done things, even within my team, which are financially driven. And I think the team would probably agree that actually it's not the ones that are financially driven that are the ones that make the difference. It's actually being able to, understand someone, empathize with them, ask them if they're actually okay, push and actually really kind of get the honest feedback and stuff from them and actioning on that. It's not the stuff that's money driven. We bought this app or we bought that. I think there is a lot that you can probably do around that space as well. AJ, thank you so much for coming along and taking the time. You're a star. Really appreciate it.
Thank you very much.